The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Sierra Morgan and Samantha Kelly. Sierra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hello, everyone. Today we get to have two guests on our podcast. We have Lauren Reyes and Janet Jones with us. They are the co-founders of Breastfeeding Success here in Austin, Texas, and they are here to talk all things breastfeeding with us. We have some little things we want to get talking about specifically today. So we're so excited to have you guys on as guests. Thank you so much for being here.
Thanks so much for having us.
Awesome. Thank you. Well, to start us off, can you just tell us a little bit about Breastfeeding Success and kind of what y'all do here in Austin? And I know you kind of have a larger reaching kind of arm as well. So can you share a little bit about who you are?
Definitely. I'll start and I'll let Lauren round it out. So I'm Janet Jones. I'm one of the co-owners of Breastfeeding Success and an IVCLC. And Breastfeeding Success is a comprehensive lactation service provider, really essentially across the state of Texas now. We prenatal education, as well as in-hospital support, and then postpartum outpatient services are really kind of all-encompassing. We do believe that, thinking about our mission and our vision, we believe that all families deserve high-quality access to lactation care, regardless of their income or their insurance. And so we do provide that service to every family, regardless of income or insurance. And we provide quite a bit of our services as uncompensated care. Close to half of our care we provide to families as uncompensated care because we believe in that mission. I'll let Lauren go into some more of the specifics about our team and kind of where we are across the state of Texas.
Thanks, Janet. So, excuse me. When Janet talks about being across the state and having comprehensive care, that there's a lot that goes into that. So we have 55 IVCLCs, which stands for International Board Certified Lactation Consultant, and then all of the people that support them, which are managers. We have graphic designers, billing experts, practice managers, and the list goes on. So we provide, as Janet was saying, we provide care both in hospitals and then in co-located outpatient clinics that are in hospitals and also standalone. And we're all the way from Dallas down to Kyle and expanding. So our business model is to mostly the big amount of business that we do is in hospitals. And so we partner with hospital systems to reduce the cost that they're currently spending on their lactation departments and create a specialist model. So not only are we providing care to families across the state, as Janet was saying, regardless of their financial ability, but we're also teaching hospitals and providers how to value lactation services, value lactation consultants, and how we can be part of the specialist model. So yes, we provide direct services, but we also teach physicians. We are the primary preceptors for a third-year resident elective that's through Dell Medical School. We also provide training to every single nurse that's in a perinatal setting at the 11 hospitals that we now serve, which include level 3, level 4 NICUs and a children's hospital. We do international speaking engagements and teaching. Janet sits on our an International Professional Organizations Board, which is called ILCA. And I'm a former board member of our national professional organization, which is called USLCA. We do also, and I'll end, but we do also have the only paid lactation internship that I'm aware of. And I believe we've already created 12 IBCLCs. Correct me if I'm wrong. Okay. I think it's 12.
We've had 22 people come through, and I'd have to look at the numbers again, but yeah, the vast majority of them, we have a couple who are still waiting to sit for the exam, and a couple who exited the program before they finished. But the vast majority of those have completed and now gone on to become IBCLCs.
That's awesome.
So, yeah, it's awesome. Without that, so many people that want to become board certified lactation consultants would find a barrier to entry. And Janet and myself are part of that. We were taught or we were paid to do this through the federal government, through the WIC program. We were participants for a low-income government subsidized nutrition program that at the time was providing basically paid internships to its own participants to become IBCLCs. And because that program has been changed to not be quite as supportive of that entire model, we stepped in and decided that we were going to be that place for people to get that clinical experience and create more IBCLCs, because that helps meet our mission of every family in the state of Texas having access to high quality support. Another part, and again, I won't go on forever, but a big part of what we do is working with healthcare administrators, not only in hospital settings, but also at the insurance level, to help them understand what their legal obligation is to their patients regarding, of course, the Affordable Healthcare Act and the Women's Preventative Health Code of that. And then also working with hospital administrators to help them understand how to incorporate lactation services and, when they're needed, how to, call us, things like that. So there's a lot to what we do. And certainly it's all very exciting.
Yeah,
That's
absolutely.
So huge.
And I think it's really important for people when we go into the conversation we're going to have, and we want to have you back for another episode too, because the wealth of knowledge that you have and the breadth of your understanding of this entire thing, you explaining all of what you guys do helps people see that what we're about to talk about, you guys are absolutely qualified to talk about. So I'd love to start a little bit about the Breast is Best campaign. And would you be able to kind of explain to us the origins of it and then how it also influenced public perception about infant feeding?
Yeah, I can start off on that. So the Breast is Best campaign really started as an effort to raise public awareness of the benefit, or just the public health benefits of breastfeeding themselves as a biologically available and adapted human milk, species specific milk for human babies it's impossible to replicate in a lab. And I feel like we come through different things, come in waves, and there's ebbs and flows, and there was a big push back in 2012. There was a big push in 2008 to really help to provide a little bit more support. That's where the Affordable Care Act came in actually putting some teeth behind that public health campaign by providing lactation services as an insurance benefit. But we still have such a long way to go in actually removing those barriers for families. And I do feel like that now, with some of the newer marketing of formula industry and marketing from some other groups as well, that some of those messages have gotten a little bit lost. And we're starting to see now, for the first time in a really long time, initiation rates of breastfeeding decreasing. For so long, they've been going up and up and up. Everybody who came into the hospital that we served knew that, I've heard breast is best. So it's a very catchy slogan. It's easy to remember. It flows from the tongue very easily. But now more and more people are starting to say something else. They're not really saying that anymore. And we're, for the first time, really seeing a decrease in initiation and exclusivity of breastfeeding because of it.
Yeah, I think it's hard as a parent when you're hearing all of these mixed things, and we see it like in mom groups and kind of all over the place of like, oh, you have to do it this way or you have to do it that way, and there's so many conflicting opinions and information out there. I think it's just so hard to kind of figure out what is going to be best for you as the parent, as an individual, and kind of figuring out what's going to help you be most successful, happy, healthy, mentally and physically. It's just such a big piece of it. And I think with the Breast is Best campaign, something that we saw is that it created a lot of like guilt for people of like, if you can't breastfeed for one reason or another, and that is a real thing, what am I supposed to do then? Am I failing? And then we saw this kind of other thing coming up. So can you tell us a little bit about how the Fed is Best movement kind of emerged as a response and what impact it's had on both parents and the healthcare system?
Definitely. So I will say, like, from personal experience and working throughout across the state of Texas, and then also sitting on our international board, that this is pervasive across every demographic, and it's definitely more popular in the United States, but it's happening worldwide. And I will say that it's a very catchy slogan, and I think it's brilliant from a marketing device, because who would not agree with that? Of course, we want a fed baby. Everybody wants a fed baby, and a fed baby is best, of course. And I think that we have to be at a place though where we're not demonizing. And I hear that all the time too, that whenever we talk about breast milk itself, that, oh, well, we just can't make moms feel guilty. And unfortunately, all of this does play into the marketing and formula industry. And providers of breastfeeding support, or just like parental support in the hospital, are some of the biggest targets for that marketing of formula. And that marketing is designed specifically to play into the fears and the innate feelings of inadequacy that women experience in so many different facets of our life. And formula companies, like, this is directly coming from a CEO of a formula company, that we're selling peace of mind. We're selling sleep to these parents. And a lot of the newborn behaviors that are completely normal, the crying, babies, that's the only way that they can communicate, is by crying. And so their cry means so much more than just hunger. But again, we want to do something whenever that baby cries. And the first typical response that most of us have is that, oh, well, oh my God, he must be hungry, or she must be hungry. And oh my God, does that mean that I'm not making enough? And again, plays into those fears of inadequacy.
It's big. I think I hear this all the time from clients when they're leaving the hospital. They're like, well, I just want to have some formula, or even in our prenatal appointments, I just want to have some formula on hand just in case I'm not making enough, or just in case. But I don't think that it's clear enough always that just in case is more likely to come true if you are, I guess, allowing those doubts in almost.
Yeah. So when we talked about this question in particular, we talked about Janet giving a very scientific, very fact-based answer, and then me going into from the experience of an IBCLC in a hospital or home setting, how we're confronted with this messaging. So here's a perfect example. You come in to get report in the morning from a nurse, and she says, well, it was 2 a.m. and the baby was crying, and I gave a bottle because, fed is best. And then we say, well, thank you. thank you for giving that baby food, because we agree that a fed baby is the baby we all want. Tell me more about that. What type of food did you give this baby, and how much did you give? And did you, have a conversation to get informed consent or informed, denial from this family? And then a real conversation starts. So, as you know, the more advanced you get in your practice, you see everything in shades of gray. And you're not going to say, well, why did you do that? But when people tell you that in a defensive tone, you know that it's not completely based in a really fact-based approach, right? So yes, obviously we want all babies to be fed, but our response to that is that we want them to get the best quality food that they possibly can get, and we know that that is their mother's milk when available, or another human person's milk. And forgive me, I should have said their lactating parents' milk, then another person's milk, and then the milk of another species. So we're not arguing that kids need extra, and we're going to go way further into that when we talk about the historical context of this. What we're arguing for is that we protect that lactation for that family. So if we're going to give a supplement, that we get that family hand expressing and pumping, and that we explore alternative options to non-human milk whenever they are available. We are not arguing, and I don't think you will find a lactation consultant on this planet that is arguing against supplementing babies. We just want it to be done in a way that protects the breast, that lactation, protects breast focus, and then of course feeds the baby. So more than anything, there's a lot more commonality between the breast is best and the fed is best movements than people, really understand, I think. And we're all saying the same thing at the end of the day. People saying breast is best doesn't mean don't give formula. It means go with breast first. But clearly we were wrong on that marketing. It wasn't, Janet and I who invented it, but to make people feel othered never feels good. So that was off, and it definitely put a chink in the armor. However, there's a lot more that we're all saying that is the same than different.
Yeah. And I have a couple of thoughts in my mind. One is the it's like both of these, breast is best and fed is best, both are a little offensive to certain populations. It depends on who you're talking to. And, we've had moms that have planned only to formula feed because they know whatever, they have a mental health thing, or it was so hard for them last time. And they're like, I'm not doing that to myself again. Or there's a history of abuse where they just cannot, there's a trauma there. And and it's very expensive to get donor milk. It's not sustainable for most people. And so we had a mom go in that felt very judged by the staff that she was choosing to formula feed right off the bat. They assumed she wasn't educated. That was one of the things they wanted us to help advocate for them in the hospital for. And then you turn around and on the other side, this fed is best then makes some people who exclusively wanted to breastfeed feel like, am I doing this for nothing? Am I just like having a chip on my shoulder and being selfish by working so hard for this? And it really doesn't matter, because then fed is best kind of makes it seem like it doesn't really matter what they get. So it's so difficult because there's this dichotomy here, and we're really trying to help everyone. But in the process, we accidentally turn people against each other. And I think that the biggest roadblock here is that a lot of the people in the medical system have an opinion very strongly one way or the other. And it depends on who you get when you're there to whether or not you're going to get the support that you need. And you may accidentally be being sabotaged because we have moms exclusively wanting to breastfeed or use their milk. And then they're leaving the hospital with them saying, you need to feed this baby more. We just had this last week. You need to feed this baby more because she's already lost 7%. And now she may have to be admitted or whatever. Like, they're saying these things that sound scary. And now this mom goes home and automatically starts feeding formula because her quote unquote milk hasn't come in, but she's feeding it a large amount and she's not pumping. And now her breasts aren't being stimulated as much. And then we're sabotaging it, right? So it's such a hard balance.
You're so right.
I want to. Can I? I'm sorry.
Yeah.
Go ahead, Janet. Then I'll. I'm so sorry. I want to speak to that from a lactation administration perspective. The way that we were trained and that we train all of our IBCLCs is, of course, to have a family-centered approach. And this is the foundation of our training. So when we walk into a patient room, we say, hello, I'm Lauren. I'm a lactation consultant. My job is to help you to feed your baby in whatever manner you choose to do, just making the best choices, the most informed choices you can for your family. We do not have an agenda. And that's one part of the campaign that we were just discussing that can be really triggering for us as providers, that we would not be given the same deference that of all the other providers, to know that we would come in a non-judgmental way without an agenda, because we do not. So our job is to make sure that whatever that family chooses, they're getting all of the information that they need to make, to have healthy outcomes. So when we come in and say, tell me about how you're going to feed your baby, what are some of the barriers that you're experiencing? What are some of your successes? If a family says right out of the gate, I've chosen not to breastfeed, I've done my research, we're going to say, okay, great. Let us go right into helping you with not breastfeeding and helping you to feed your baby in the most healthy way that we can. Have we considered this? Have we considered that? We talk to them about possibilities of pumping if that's on the table, or not doing that, suppressing their full milk production, having donor milk, all of the different options, and whatever they choose, that's what we support. So really what our message is that with more high quality lactation support, you're going to get better health outcomes, and also you're going to see less of this. And I do just want to speak to one of the things you brought up, which is that often it's under educated providers that are using their own life experience to really project onto the patient. But when you have somebody who's a specialist in lactation, that you are much less likely to have that. So what we have found in hospitals that we have started working with is that many lactation teams across the country, because they have limited funding, will prioritize those patients that enter the facility wanting to, quote, exclusively breastfeed or just breastfeed, meaning that those families that choose that they come in saying, I either want to do both or I don't want to breastfeed, do not see the lactation consultant. And that in itself not only is inequity, but it also provides less quality care. So their experience may be, I really wasn't seen. Nobody, helped me with this. And then, of course, we're going to have poor health outcomes. So the first thing we do as Breastfeeding Success when we start at any new facility is that our goal is to see 100% of the patients that want to see us, of course. And that is to have that crucial conversation that we are adequately trained to have. And then we get the support that they need to make the best choices for their family. So again, it's back to having adequate support, not to exclude the lactation consultant because of the malperception that we would have some skin in the game about what their choices are. We do not. And, we're really there to support whatever choice they make. Go ahead, Janet. I'm sorry I cut you off.
No, I just wanted to briefly speak to, the thing that you mentioned, that the Fed is Best campaigns sometimes makes it seem like they're basically two equal options, and it doesn't really matter what you do. And I do hear this all the time. Like it does one bottle, I don't care. I need to sleep. Just give the baby some formula, and not really, again, thinking about the public health implications of that. And just briefly, like the reason that there is the effort for this is that, it's estimated we would save 820,000 lives each year just related to breastfeeding. And this was a study in the United States with 3.2 million births looking over the first year of life. Children that initiate breastfeeding had a 26% reduction in mortality. And that is, it's not just because of the milk itself. It's all of the things that go along with it. The hormones that are in there, the immunofactors, the living antibodies that change every single day to meet baby's needs to help fight off infection. It actually really helps with the psychosocial aspects as well. It releases oxytocin to help reduce stress in both the mother and the infant. It helps with craniofacial development. And of course, like the components in there are specifically designed for human brain development. So there's passive immunities, there's oligosaccharides. It's establishing that good bifidobacteria in the gut microbiome that has long lasting, like lifelong health benefits and prevention of diabetes, obesity, Crohn's disease. And then, of course, like for our teeny tiny babies, we see, 67% reduction in necrotizing enterocolitis, which is where a part of the gut like dies off. And that's one of the leading causes of death in the NICU. So it is so important that as healthcare providers, that we do not succumb to, again, that marketing from the formula company that, oh, it's organic. We use all clean sources for our ingredients. And we've done, this is the research. So we've added these new, and this is going to be, I will say, coming up in probably the next 10 to 15 years, that is going to be the biggest area of research, really looking at more of the components in human milk, and then the formula industry doing what they can to try to mimic that and then market that and advertise that as, oh, it's just as good as breast milk. So again, just wanted to mention that it truly does make a difference in the long-term health impacts and in infant mortality, not just in third world countries, in America as well.
Yeah. Yeah. I think it's so huge. And I think it's important to, remember, like we're, I guess for our listeners to remember, we're not bashing formula by any means. Formula is amazing. And we're so glad that it exists. And it's so amazing that they are doing all of these things to try their best to match it to breast milk, but it's not going to be perfect. And if we have like levels of what's the top level, second level, third level, like human milk is going to be the best milk, and then everything else from there is going to kind of come down. So I think that's, yeah.
I would love, and I think a lot of us would love a place, we would love a world where there is enough human milk, like species specific milk, to be able to go around to replace the need for any other substance. And there's a ton. There's so many different milk banks that are out there. There's so many parents who are lactating who make more milk than they actually need for their babies. So we would definitely encourage that donation. It's gotten a lot more attention, and there are more resources for families who do want to provide human milk. But yeah, ultimately, we would love to go to a place where we are just able to provide the milk for all of our babies.
Yeah, and we're getting there. We're getting so close. Well, I think this was really awesome. I think this is a great introduction to just kind of the marketing of breastfeeding. And I know in another episode, we're going to talk about some of the history of breastfeeding and kind of how we got to where we are. And I think that's going to be really helpful for our listeners. So thank y'all so much for coming on and sharing about all of this. And we can't wait to have you back on.
Thank y'all.
Thank you.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.